everybody. Welcome back to the Laugh Cry Club. I'm Joy.
I'm Rebecca.
How are you, everybody? Welcome. Reminder, we are two licensed therapists here to make you feel better. That is it.
Yeah, that's all we're here for. We're here.
That is the only reason why we exist.
Yes, on Earth is to make you feel better in all sorts of ways, like therapeutic ways, and just also friendship, fun,
you have
and
a community.
Laughter. Community, yes.
Mm-hmm. You are not alone. So we pick a topic every single week that kind of covers maybe things that are more popular in the mental health world, relevant, or seasonal. So this week we decided to talk about the self-diagnosis craze because this happens all the time. This actually is nothing too new. Rebecca and I see this all the time in sessions, and it really became more prevalent, obviously, with the birth of the internet and social media because people like to Google things and they like to look up symptoms. We do it all the time too. If you have something going on with you, you're like, let me Google this symptom to see what I have. And this is not a perfect science of Dr. Google is not going to give you the most accurate contextual diagnosis based on you as an individual, but we understand it. So people will come to us and they'll say, I think I have bipolar, or I think I have borderline personality disorder, or I think I have ADHD. And so we want to just talk a little bit about the pros and cons of that and why specifically, I think something that I've seen more prevalent in that space is why everyone thinks they have ADHD.
That is the hottest topic now.
It's a hot topic.
It's actually one of the top Google searches right now is ADHD. Like everybody thinks they have it, and it makes a lot of sense. But I would say that not everybody that thinks that they have it has it. I mean, it's very specific. There are very certain criteria. But I think that it comes up for people because it's highly relatable. I think it's gotten to a point too where the ADHD symptoms, people can see themselves quickly in it. I would say I think this is across all the generations, but I also feel even as we age, we get to perimenopause and menopause for women and non-binary folks, that our attention span starts to decrease and all these symptoms come up where it's really easy to be oh my God, I think I have ADHD. Well, maybe you don't. Maybe it's just related to your hormones or other things happening.
Right.
Yeah. I'll say one of the biggest things is oftentimes people think they have ADHD, but it's actually anxiety. Those symptoms, I think sometimes even as a therapist and even psychiatrist, I know when people come in with a certain level of symptoms and they're addressing them, they're it can be hard to tease out, is it truly ADHD? Is it anxiety? Or even sometimes depression? Because all three of those diagnoses, the symptoms can overlap.
And this is often something that we see with a trauma, PTSD diagnosis, that trauma can show up and present as ADHD as well. So we want to suss out the differential diagnosis, and that's why it's really important to talk to a medical professional, to talk to a psychiatrist or a therapist around your symptoms and specifically in the context of your life. While I do appreciate social media and the internet for educating us on mental health and normalizing mental health, it can do a disservice of thinking there's something wrong with you, or maybe that you are going to start some medication, or maybe you kind of I don't know, sometimes people will be I took my friend's medication and it helped. Those things are really dangerous. You just can't, I know that people will be oh, I took my friend's Ritalin in college to get a paper done. And it's okay, this is where we're crossing some lines here. That can be a little bit dangerous. I just don't want people to normalize that type of behavior. But do we want to just kind of go over criteria for ADHD really quick of just to kind of educate people on what that is? I mean, it's a neurodevelopmental disorder. So it's not a personality trait or a vibe. It's not just
it's not a vibe.
It's not a vibe.
If it was a vibe, I'm sign me up for it. It sounds like a great vibe. Right?
Well, I think about, and I've said this to you before, and I know people, I want to be careful and respectful of diagnosis because of, obviously we're in this field, but sometimes it's very easy to let this fly out of your mouth where you're I'm so OCD or I'm so whatever. I get it because it kind of makes it's an easy way to express a personality trait, but these are actual diagnoses. And so for ADHD, it's neurodevelopmental disorder. It is not a personality trait. So a diagnosis requires a persistent pattern of inattention and or hyperactivity that interferes. This is important. This is so important. Everyone listen closely. It interferes with functioning. Okay. So this is where I think a lot of people think that like, oh, I have this blah, 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 but you're able to go throughout your daily life without it interfering with functioning. So what does like interfering with functioning look like? It means that you are not able to organize tasks and activities. So this would be you'd have to have, and we're going to breeze through this quickly. So you can actually look up the ADHD criteria from the DSM, which is our diagnostic manual for mental disorders. It has to meet this criteria. So just very much like a doctor, if you go to the doctor and they have criteria of what you have to meet to have a certain medical diagnosis. Some of these things for interfering with your life or interfering with functioning would be you have difficulty organizing tasks, you frequently lose things, and so you have to meet for inattention, you have to meet at least 6 symptoms for over 6 months. So it's like a sustained, persistent pattern.
It's got to be persistent.
Sustained. And I'm not going to list them all, but it's difficulty sustaining attention, conversations, you don't listen when spoken to directly, you fail to follow through or incomplete tasks, you avoid or dislike sustained mental effort. A lot of people could be like, well, I have that. All of those things are me. But it's like, okay, but are you able to, what we're talking about when you frequently lose things, like keys, phone, things that you're like daily late to work because you're like, I don't even know where my phone or keys are.
Right.
Like that is where you are. That's what we mean by interfering with functioning.
Not like a one-off or maybe once a month.
Exactly.
You were talking about 6 of these for 6 month period. You have to demonstrate it. And there are 9 different criteria that you have to have 6 of those 9 to meet this diagnosis. So I would say one way to know, you'd have to meet these criteria, but it's for people that say they're at work and they're constantly struggling to get tasks done on time. Like a boss says, hey, we need this by the end of the week. And you find it's Thursday night and tomorrow's Friday and you're up all night because you've procrastinated all week to try to, and now it's like go time and you have to get it done. Or it shows up in school or college in coursework where you're just forgetful about assignments or you're procrastinating so long that you have to stay up all night and then you kind of turn in work that's not maybe to your standard. It was just like getting it done and almost rushed to get it done.
Yeah. And the reason why I think a lot of people are relating to this is because we live in a world that sets us up for this type of behavior. We have constant notifications distracting us. We live in a distracted world. So everything presents like it's like we have ADHD. We're task switching constantly. We have short form content. Content is presented to us to be very quick. We have all of these streaming platforms where we can just scroll through very quickly and constantly be fed these hits of dopamine and these hits of like, what do I want to watch? We have way too many options. And so as we look at this, we're like, if you have too many options, you get stuck in analysis paralysis and you can't make a decision. That does not mean you have ADHD. I'm distracted a lot because you have the phone, the ping on your phone. And so I am able to function in my life. It does not interfere with my daily functioning. So these are the things that I think I want people to really understand. And I didn't go into like the hyperactivity, impulsivity, or any additional criteria. There's way more to the actual ADHD diagnosis. We're not here to like dive fully into that, but more about why people are kind of drawn to this self-diagnosis craze.
Yeah. With the self-diagnosis craze, it's like one of the top ones or top few that people are trying to get diagnosed with would be ADHD or neurodiversity. Neurodiversity is not a diagnosis. That is not in the DSM-5 criteria that we diagnose from. ADHD is, and there are different types of ADHD. So it gets very specific when you see a therapist or a psychiatrist, psychologist for a diagnosis. I think a few things to consider too with an ADHD diagnosis is that what is the treatment? You can say that I have it, but if you really think you have it, then the doctors are going to be like, well, if you do qualify for the diagnosis, the treatment option, the best way to treat ADHD is through medication. That is the top way. And some people are like, ooh, that's a stimulant. I don't want to be on a stimulant. I don't want to be like on a drug. I know people have a lot of concern with their kids being on a stimulant, which is totally understandable, but it is safe as long as it's, watched from the psychiatrist and we're keeping track of eating and habits because it suppresses your appetite, you may not want medication. And so you're going to continue to experience these symptoms. And I think people should just recognize that too, that medication is the number one way to treat ADHD. Therapy helps too by learning skills on how to adapt and be able to make routines that work for you, but they will prescribe you a medication. And the medications work great for people. They really do. Joy, I think great point too about, why we think we have it, because you're right. We live in this world where it's constant information. And so it's like increase like digital screen time actually leads to, we know the science is there, the research is there to decrease sleep quality and reduced physical activity. These are two crucial things for brain functioning and health. And what those do when you don't sleep well and you're not active, it starts exacerbating ADHD symptoms. Now, you may have symptoms or traits of the diagnosis. That does not mean you meet the criteria. I mean, just like we throw the term around like, oh, I'm really depressed today. Well, I probably have symptoms, but I probably am not meeting the complete diagnosis at that point.
The complete diagnosis of a clinical,
yes,
like a clinical criteria of depression or depressive episode. There's a range of what we would diagnose for depression. So that it's really the education around mental health being normalized. Wonderful. That there is so much more to diagnosing. Really, the treatment planning that goes along with that is so individual. I think the hard part as a clinician is, and I really don't want to gloss over this or make this sound like it's easier with a medical diagnosis in terms of if you have a cold. So if you have a cold, you can go online and be like, I have a cough and runny nose, and it'll be like, take some Sudafed.
Right.
And maybe you take an over-the-counter Sudafed, and it's like, actually, that did help. Where with mental health, it's not that straightforward. It is not like, well, with ADHD, you should take this supplement, whatever. I'm totally making this up because I don't even know what supplements it would say. But, there's a supplement for everything, or there's like Reddit boards for everything. And this worked for me. And I would really caution people to do that, especially with mental health. Again, the context really matters because there is so much in mental health that we have to suss out what we call differential diagnosis, where it's like, does this person have do they meet the ADHD criteria, or is there a very strong history of trauma in their life? Let's talk a little bit about that, because trauma, like I said, can present as ADHD. Maybe there is some crossover. However, these are things that we have to look at the whole lifespan of the person and the individual, just what makes up your life, the personal experiences that we really need to dig into before we can actually make a diagnosis. And it's not as easy as like, this works for me because my friend has ADHD. It's like, not the same. We are so complex.
It is not the same. And
snowflakes. Just think about it. Mental health equals snowflakes.
True.
Not in the sense that like we're special snowflakes. I'm just saying we really are special snowflakes. We cannot treat it. Everyone is so
unique.
Different.
Yeah.
Unique. Yes.
No snowflake is ever the same. So just like us, we are not the same. So it really is important that if you think you have, a mental health concern or diagnosis, that you meet with a therapist, psychiatrist, psychologist, even talk to your medical doctor a lot of times. They can refer you or be like, well, let's go over your symptoms for depression, anxiety. It just kind of depends on your doctor too, how comfortable they feel about treating, because a primary care doctor can treat your depression and your ADHD and your anxiety, but some of them feel like they don't feel very comfortable. And so they want you to go see a psychiatrist to get a prescription for medications then. But I think we live in this world too, where we have all these influencers on TikTok or social media, and they get to a point where they start to peddle something where it's like, hey, I use this new vitamin. It's really great. Or this skin cream or whatever it is. Or I drink this drink. That's a product endorsement deal. If you start to look at products that people peddle through that eyes of like, do I really think this actor or this really big influencer uses this product every day? Probably not. They're getting paid to use it.
That always makes me so mad. I mean, right now what I'm hating is the Grunes gummies.
Yes, they're everywhere.
Every celebrity is peddling Grunes, and I'm just over it.
You're over it. Yeah. I mean, they may work. I don't know. But I've never tried them.
Well, it doesn't work because it's the newest fad of saying shortcut to eating a whole foods diet.
Oh, yeah. Yeah. It's like what is that? A1, the greens or whatever?
AG1. It's
AG1.
the same thing.
Yeah.
There is no magic powder.
It's not magic.
To give you the full, like, just eat real food. That's really
You could potentially supplement, like say you're athletic or whatnot and you're struggling with it and you've talked about it probably with your physician, because they should know every supplement you take because it can affect your health and your medications that you take. But I think you should have a conversation with a medical doctor about it before you take it.
1,000%. And that's the thing, is we want this like easy fix and we waste a lot of money. And I have a lot of friends who are registered dietitians who just talk about this all the time. And they're like, these supplements are complete trash. Eat a whole foods diet. You are likely not deficient if you're eating a whole foods diet to where you need this stupid gummy. At times, sure, like a multivitamin is probably not going to hurt you, but talk to your doctor about where you are deficient and what you should be taking, because we have just gone so far off the rails of thinking that we can take this into our own hands, which, look, fine, follow the basic guidelines of getting movement every day, eating whole foods, drinking enough water. We can take that into our own hands. But once you start going up and down the vitamin aisles, which I used to be guilty of doing, and being like, do I need turmeric? Like, you know, and then you just start wasting all this money. And I just remember whenever I get into that trap, I think of my dietitian friends who are like, it's just expensive pee. Like, stop buying this stuff because just like, I mean, if it's like, what is it, water soluble versus fat soluble, like whatever your body doesn't, whatever your body doesn't need, it'll pee out. Like a lot of things that are not fat soluble, you're just peeing out anyway. So they're just like, anyway. So it's just, this is where we kind of have to reel it back in, talk to your doctor. And this is something I did recently. I talked to my doctor about like, okay, what do I actually need? I had blood work done and they made the recommendation of things that I actually could take where you do want to spend your money on. And like, we live in times where things are not cheap. So it's really important to think about. Do you watch The Pit?
I love The Pit.
Okay. Yeah. Have you seen the recent episode where the lady takes too much? I think it is turmeric actually. She overdosed.
Liver failure.
Yeah, she went into liver failure. And the doctors were like rolling their eyes. Now, granted, this is an obviously like drama show, but it is based on real life. The writers are actual doctors who probably have come into, encountered people who take an insane amount of supplements thinking that they're going to make their life so much better and like reduce inflammation by taking an insane amount of turmeric, and they turn orange, they have liver failure. So that is the risk of self-diagnosing in any type of scenario, but specifically mental health. So being aware of this, and if your friend was helped by it, that's not going to mean it's going to help you. That doesn't mean it's going to help you.
Right. I think you just have to be, you just use some discernment when you are considering taking things or that somebody else has taken, and be mindful that most of the things that you see on TikTok specifically, because that's kind of the leading content place right now, is inaccurate and misleading. I'm not saying all of it, but the majority of it is, because you have a lot of people self-diagnosing themselves and then they're talking about it with other people. These are people, they may just be a person, just a regular person. They may be a life coach. I want you to use some discernment even with life coaches. They are not to diagnose you. They are not trained in the DSM-5 to actually diagnose. Both of us are behavioral health coaches. We're certified, but we know if we are in a coaching role, I'm not diagnosing somebody.
Right.
That's not my role.
Or something else that I see that's really hard to watch is someone who, let's say they lost a lot of weight. So then they're going to all of a sudden teach you how to lose weight. It's like, do you have are you a registered dietitian to be giving people advice around how they should be eating? Or someone who recovered from an eating disorder giving advice? Like it's fine to give advice and support from a peer perspective. There is nothing wrong with that. However, once you cross the line, and it's a fine line that people can kind of easily swerve into, if you cross the line into giving advice that leans towards what a medical professional should be guiding someone on, that is where we get into slippery slopes.
I think people just need to really be careful out there. We live in this, I think, goes into a conversation we had too about all the stuff that we see online and what should we believe it or not. We live in a time period where our brains,
the bamboozling is real.
We are being bamboozled all the time, and it's actually insanity to think this is where we are. Like our brains, like think about your life. You have so much stuff to do already, like taking care of your home and your family, going to work or doing volunteer work, whatever your passion or pleasure is in life, you're doing it. Now I have to, if I see something on TV or on my social media, I have to think, is that real? And what's the research behind it? It taxes your brain so much that a lot of times we are thinking we have ADHD when maybe we don't, or that we're neurodiverse when we probably aren't. It's just, this is the society we live in. And so it's just really taxing. I just feel bad for all of our brains because we just always are having to think,
so exhausted.
think.
It always has to be on, and this can really lead into anxiety because our brains are already very active and very good at making meaning. Remember I was talking about that? Where
Meaning maker.
We're meaning maker machines, where we want to have answers to everything. And, you know, that trips over into anxiety and depression. But thinking about now we have AI, and every video that I see now, I'm like, is this AI? Am I being bamboozled? Because it's legitimate. And that is everywhere I turn, there's, you know, a cute video. Someone sent one the other day and I was like, you know, this is AI, right? Like, we don't, because it's so real and it is the weirdest thing. I truly feel like I'm living in the futuristic world that we always thought like was the Jetsons, and it's here. And what is that doing to our brains? I'm sure the research will come out in 20 years of how this really affected us as a society and a human race. But it's just really important to kind of bring it back to, is it something that, you know, why do you need this? And if you're really struggling that bad that you want to have an answer to maybe some symptoms, please go see a doctor. It's fine to have that like question pop up in your head, but just because you see it on TikTok doesn't mean you have it. Just because you kind of relate to something that someone else is going through doesn't mean it's the same situation. So like really quick clinical differentiators we can throw out is like, okay, ADHD, for example, it's a lifelong pattern. It's not something that's like recent onset.
Especially as an adult.
Pattern. Yes.
It's not recent onset. Yeah.
Can you say more about that?
Can I share an example of that? Yeah. Because I've seen I've just seen all kinds of different people, but I've had this experience with some individuals. This is not all. So I'm not saying new mothers have ADHD, but I've had some clients that come in and they have little kids at home and they're like expressing all these things happening. So we talk about present, and in therapy, then I start talking about, is this just symptoms of having small children at home? That's really tough. Maybe not feeling supported by your spouse. Then I start going back and looking at, well, how were things before you had kids? What was college like for you? What was grade school like? How, what type of student were you? What were the messages you were hearing from your teachers or your parents? And just, digging really deep into the past too. And then looking for the pattern. You're saying you're forgetful now. You forgot to actually pick your kids up at daycare. You feel totally terrible as a mother now. They were safe, but you recognizing all these other things, like it's hard to function at work. And then we go back, and at school, you were procrastinating all the time. You were struggling to get assignments turned in on time. You remember back when you were in grade school, teachers were telling you, like, they would say, like, snap at you and be like, hey, you're daydreaming again, or you're talking too much. Like, I was always in trouble for talking all the time, and so we just start to review those things. And it's not I meet you one time and I give you this diagnosis. I'm going to be suspecting what I think might be there. That's what we're always doing as a mental health clinician, is we're like, we know all the stuff in our head. Somebody comes and starts presenting, and it's like we're starting to put the puzzle pieces together. Does this fit? Does this fit? We ask certain questions to try to determine how the pieces fit. And then we eventually will get to, here's what we really truly believe the diagnosis is. But a life coach is not going to go back and start looking at your patterns. They're not supposed to necessarily. And an influencer isn't going to do that for you.
Yeah, even though we do like the quick fixes.
We love them because I think our society has trained us for a quick fix. No one wants to do the work.
Our environment,
we want it now.
We just want fast answers. And it's so hard because we can't always have that, especially with our health, especially with our mental health. It does take time. It takes a lot of effort. And it may be a more complex thing that we have to figure out. We have to get comfortable with the uncomfortable, all of those things we've talked about before. And I hear you. I'm the same person. Like, I don't want to have to go through like the hard, exhausting thing of being like, all right, I just really want to find out, like, I just want the magic pill. I mean, we just live in that society. So give yourself some grace also to know that we live in a world that is set up for us to fail a lot of the time.
That's what these quick fixes are. it'll lead to failures because they don't last, right? It's like you have to, like if you talk to a dietitian about, say, GLP-1s are a big craze. It's like, I think they're great, and a dietitian probably finds them very helpful for some people. But it doesn't work if we don't also develop like healthy eating habits and learn like how many calories does my body need to function. It's like those things are really important. Like our bodies need a certain calories just to live in the day. But then if I add an exercise on top of it, I'm going to need an additional set of calories. And that's why it's so important to talk to a professional in whatever field. I think we have this focus of society of focusing on what do I have or what's wrong with me, like you were mentioning.
Totally.
But we should focus on what do I need.
Yes.
What do I need?
What do I need? I love I was just going to say the exact same thing, which is basically like we're on the same brainwave, which is like we just want to know what's wrong with us. And I just want to make sure people understand that it's like, what do I need? There's so much of this, like, I think I have something wrong with me. The label is going to then fix you. And that's not how it works. Labels are not going to all of a sudden miraculously fix you. There is a lot of differential diagnosis and there's a lot of things that might need to be talked out and addressed in therapy. But I also understand like labels can be a relief to be like, oh my gosh, I thought something was wrong with me to where I was the only one. So there can be a relief in like knowing that there's an explanation. I completely understand that. So just keeping all of this in mind, I do want to wrap up the episode by quickly explaining the difference between a psychiatrist, and a therapist/psychologist.
Yes.
And this might be news to you or maybe not, but a psychiatrist is a medical professional who is trained to prescribe medication and is trained specifically, has gone to medical school to study brain health and how it relates to mental health.
I think they have more training than a regular MD. Because
really?
they have to do the medical rotation and they also have to do the mental health component. So they're in school even longer.
Well, there we go. They're smart cookies is basically what. But I want to make sure people understand that a psychiatrist is not a therapist. So when you go to see a psychiatrist, they are trained to prescribe. They are there to learn your symptoms and treat it with medication if appropriate. Or they may say, actually, this does not meet criteria for medication, but they would give you those options. So sometimes people will think like a psychiatrist and a psychologist/therapist are, they're kind of one and the same. And actually there are some psychiatrists that I've heard are maybe dual in therapy and they can do therapy and prescribe. It's not common. It's more often you will see a therapist that's there to process the feelings, process the emotions, give you a treatment plan that may include things like cognitive behavioral therapy, EMDR. Like the treatment is more focused on the processing of whatever you're bringing to the table. Hey, I'm really struggling with this relationship in my life. And let me back up. So if someone comes to me and we're treating them in therapy for depression, and I start with a treatment plan, 3 months down the line, they're like, things are not improving. And I just really can't get out of bed. I mean, maybe even sooner, I would probably refer to a psychiatrist, but you know what I'm saying? Like if the treatment plan is not working with therapy, then we go to the next step. Sometimes right away, it's very obvious to us. But what I'm saying is therapy can treat a certain portion of a diagnosis. And there may be times when it's appropriate to say medication might benefit you here, where there's a treatment plan that includes therapy and psychiatry. So for example, research shows that medication for severe clinical depression and therapy is really helpful. That combination of the two is really helpful because you kind of have to learn the skills. And also I always describe medication as like a way to kind of get your head above water so where you can start to move forward with the tools that you learn in therapy. But that's just an example. Is the psychiatry is really going to focus on medications and how you're feeling on those medications and checking in to ensure that you're like on the right dose. So that's the difference between psychiatry and psychology. Did I cover it?
Yeah, no, okay. I think you did. Yeah, and the psychologist is, in the same boat as the therapist. They just have different training, and they're a PhD typically, or they are psychologists.
Psychologists. Yeah, and some people say, do I need to see a psychologist or someone with a LPC, LCSW,
LMFT?
Yeah, right, and really, it doesn't matter. It's really for therapy. It's the fit. So it kind of depends on who you like talking to. If they're licensed, doesn't have to be a psychologist. It could be LPC, all the L's.
All the L's.
Yeah.
In LCSW, yeah. It's I think thank you for explaining that. I think that's really helpful. But the bottom line I want everybody to focus on is that let's not focus on the diagnosis of what's wrong with you. Let's focus on what you need, because that's really, I mean, that's something I've been trying to do is what am I needing? What am I missing right now? What's my body, like if I'm feeling tired, what's my body needing? Well, I know I slept fine. I mean, I sleep fine, so that's okay. I'm drinking a lot of water. I'm drinking my daily water. That's fine. I don't have a cold. I'm fine there. Let me look at what I just ate yesterday and what I ate before my workout. Okay, that explains it. I did not fuel appropriately. So then I know I can fix that.
Yeah, it's paying attention to the well-rounded view of how you're treating yourself. If you're not taking care of the basics, then it really can affect your mental health. If you're not fueling yourself properly, if you're not sleeping well, you're constantly stressed out, these are all things that are going to impact your mental health. So if you're going online really late at night trying to figure out what's wrong with you, maybe you just need to sleep and put the phone down.
Yeah.
It is tempting. The phones are, and our social media is like set up for us to continue to use it. But
well, it's really our alarm clocks nowadays, right? I mean, who has an old school alarm clock by their bed? If you do, please reach out to me. I bet you do now.
I do have one friend that actually, we were talking about, because I'm going to, by the way, we are not releasing an episode. Let's see, this following week, whatever this comes out, the following week we'll not be releasing an episode
because Joy's going to be vacationing.
I'm going to be vacationing. I will be out in Peru. But my friend, I was talking to her about packing, and she's like, I don't use my phone for an alarm clock, so this is the one I use. I'm like, what? So shout out to my friend Sandy, who absolutely does
Sandy.
An alarm clock. And
I want to see a picture. Is this the old school red analog numbers? I bet they're so fancy nowadays.
Yeah, they're probably super fancy, but she travels with it. And I just find that so hilarious. But anyway, but I just, everyone out there, you are a special snowflake, and that you have, if you're seeking something, you're seeking answers, it's fine to kind of get a little bit of information from the internet, but really seek a medical professional. You owe it to yourself to get that individualized treatment plan so you know how to move forward and treat yourself well.
All right. If you all want to contact us, send us a message, you can email us at laughcryclub@gmail.com. We'd love to hear from you. We've heard from a few listeners, and that always feels really great, and we like connecting with you all. Make sure you follow our socials as well, and keep tuning in to the Laugh Cry Club.
Yes, we'll see you in a couple weeks.
We'll see you in a couple weeks. Right. Joy's going to be vacationing. I don't know what I'm going to be doing, but
I'll be sending you photos.
Okay.
See you next time.
Bye, everybody.
Bye, everyone.